Dr. Kelechi, what do you make? I mean, 3 years on, what are the lessons? Have we moved on from this incident?
It's been 3 years since the end SARS, and the very salient question to ask is, has the problems really ended? How about the issue was the police brutality, judiciary extortion, and the rest of that, but has those things ended? No, but we need to understand that there are some health implications that must have arisen from what happened. First of all, accountability is very important, right? How do we heal from what has happened if we haven't even been accountable, or we haven't held the people accountable for all the injustice, right? And how are we trying to heal? Do we even know that we're supposed to be healing at this time? Let's just track it back to the issue of Biafra, right? We keep saying Ozoe Mena. In Igbo, it means let it not happen. But what is not happening? What are we doing to make sure it doesn't happen? How are we healing? As a doctor, I would like to say this. It's very important that we have mental health support at this time. So a few minutes ago, I called one of the social media influencers who was really big on this issue, and I asked if she could join me to speak about this issue. And she said at this time, she's not mentally ready to even have the conversation. It's been 3 years, and a lot of us are not still mentally ready to deal with the issues.
So let me ask you then, as a medical doctor,
okay,
how can we mentally or emotionally heal?
All right. First of all, knowing that there is a problem, and also seeking for mental support deliberately, intentionally. We know how expensive it is to get mental health support. So we can start with promoting and encouraging dialogue with our peers, and also those who we think are in a better position to answer these questions. That is the government and those, involved in what happened, right? So promoting dialogue, seeking mental health, interventions, and mental health, mental health interventions, and then providing support at different levels, at community levels. And when I talk about community, we can use social media, since that's where a lot of this happened. Dialogue on social media, even at the community level, at the grassroots, even the family members of those who were, directly involved, right, or directly affected. We should have this conversation and help them get mental health support, okay? And then also we can get support from international organizations. Just a few days ago, I think on Friday, the Amnesty International berated the Nigerian government for having people already arrested 3 years later, and they haven't been, discharged, right? Mm-hmm. So we have conversations and support from the international organizations. And also, like I said earlier, mental health support, getting mental health support is really expensive. So we can, as a community, organizations, and those who are in a better position to make sure that these people who are affected get their mental health support going. Yeah.
Okay, you talked about the need for, mental and emotional healing from these trauma, the NSAS, protests 3 years on, third anniversary. I'm looking at families, the average Nigerians, who don't even understand the need for mental healing. How then do we get across to them and enlighten them on the need to heal mentally? For instance, a family who lost a family member, or who has an injured, family member as a result of the NSAS protest, but don't really understand the role mental health plays in healing. How do you feel, as a medical doctor, we can get across to them to enlighten them about the need for mental healing?
At this point, social media will really play a major role. Putting out flyers, putting out information on how to heal, the steps for grieving, and how to move on from traumatic experiences. That's for social media. And then as a station, News Central is doing this now, creating awareness, and we can, do some other sessions and put out all this information and teach people step by step how to acknowledge grief and how to heal from it. At the community level, the government, even organizations who work around mental health can organize programs, seminars, to talk to the people at the grassroots and teach them how to heal from.
Right.
Yeah. So information is really important at this time. Yeah.
Definitely. I know we're talking about, mental, healing as a result of the NSAS protests 3 years on, the third anniversary, moving on from that, how we can heal as Nigerians from these, experience we had 3 years ago. But then again, looking at our society, some will say, mental illness is just vague. It's not in existence. What do you have to say about those who debunk or who have the argument that there is nothing like mental, illness in this part of the world where we are, and that is Africa?
So statistics say that 1 in every 3 Nigerians has a mental health issue. So it would be preposterous to say that mental health issues in Nigeria is not a thing. People keep saying it's not a Nigerian thing, it's not an African thing, it's imported. No, it's not imported. It's just that now people are speaking up more, and we are realizing that our mental health is at stake. So yeah, it's a thing in Nigeria, and we should take it really seriously, right?
All right, thank you so much, News Central's Dr. Kelechi Okoro. Thank you for your expertise this afternoon.
Thank you for having me.